October is, of course, Breast Cancer Awareness Month, and surgical oncologist Dr. Majola Amole is joining us this morning for an important conversation about the realities of breast cancer for Canadians. Today, I haven't seen you in a while. Dr. Amole, it's good to see you. I'm wondering if you can start with a quick overview of some Canadian stats for us.
Good morning, nice to see you again too, Tracy. So when we talk about breast cancer, we know that the majority of people who have breast cancer are between the ages of 60 and 75. But now more and more, we actually are seeing breast cancer in younger women, which we consider less than 50. But it's good to remember that even though if they present at an early stage with the cancer having spread, that they have we consider them long-term survivors, and even that they could be cured. The other thing that we're also noticing is that we're having now women over the age of 75, as women are living longer, and people in general are living longer, that we're having that age group also being affected by breast cancer. I think we all know that with the Ontario breast screening, that the screening stops at 74, though. But we are seeing that the older and the younger generation are starting to show more breast cancer.
Do you advocate for women to go ahead and get those screenings done, even if they are above 74?
I have this conversation with my mom because she's like, well, no, I'm over 75. They won't do it. I'm like, no, you're in good health. If you did have something and we caught it in an early stage, we can treat you. So please go ahead and get your screening every 2 years.
Okay, so let's talk about that because we are in the age of COVID. So can women still get these screening tests? And should they be going for their annual screening at this time? Or is it just too dangerous?
So they should 100% be getting their screening. According to the Ministry of Health, we've at the beginning of lockdown back in March, we had stopped doing any screenings. We were still doing it if you had a symptom and then you'd go get your mammogram. But back now we're able to get screening. The hospital's a very safe place to be. The breast centers are a very safe place to be. We all know that if we're all wearing masks, it reduces the risk of transmission by a lot. So it's very safe to do. I'm currently out up in Northern Ontario, in Dryden, Ontario, and the mobile screening is still happening. And so I tell women, regardless of where you are, currently it is safe to keep on going until the ministry tells us that we have to go into lockdown again.
Okay. Now, there was a study that came out last year that found large gaps in race-based data and research on breast cancer among Black women in Canada. And I'm wondering if you could share your thoughts on this.
This is a very important and something that I'm very passionate about is when we talk about race-based data. Canada in general, we do not collect race-based data. I think part of that is we like to view ourselves as being anti-racist. But as we know, a lot of anti-Black and anti-Indigenous racism occurs heavily in Canada. COVID has made us start to think that we have to start collecting race-based data, and Ontario has started collecting race-based data on that. When we look at data from the UK and from America, we know that Black women disproportionately are affected by breast cancer. They tend to present at a later stage, and they tend to have worse outcomes. Part of that is socioeconomics. Everything is tied into that. So currently we don't have that information, and a lot of us in the field are pushing for it because we know that if you're not counting us, then we technically don't count.
I'd like to talk about something that's really important for many young women who get diagnosed with breast cancer: fertility preservation. A lot of these women haven't started or completed their families yet, so the possibility of infertility can be a huge source of distress. Where are we at in 2020 in terms of fertility preservation? What options do women have? And is it true that women face an increased risk of their cancer coming back if they do become pregnant after completing their treatment? I know that's a long question, but what do you think, doctor?
So I'll just start off with where we are in 2020. Fertility preservation is in a great place in terms of women who are undergoing any sort of cancer treatment. Currently in Ontario and Quebec, it is covered. So actually one of the standards of if you're a good cancer center is, do we have this conversation with you when we first initially meet you? Some women, they don't even know. They're not even sure yet if you're on the fence of, do I want one more kid? We're just waiting for the right time. What I usually tell women is, it's one of those decisions that it only takes about a month or two for you to undergo the treatments to freeze your eggs or freeze embryos if you are with a partner. And at that time, you can make the decision once you're done your treatment. Currently, we have no evidence to show that if you undergo chemotherapy or all the other treatments and you got pregnant after that, there's an increased risk of cancer. There's no evidence of that. But there's actually currently a study that's being done right now, both in the US and Canada, that's looking exactly at this question is there a higher risk of cancer? I think the answer we're going to get is probably not, and that it actually might be protective for some women with certain types of cancer.
Really good information. I mean, all of it. Really great information, Doctor. Thank you so much for catching us up and keeping us well informed.